I'd like to introduce Dr. Bob Lawrence from Wales. Welcome, Bob.
Hello, I'm pleased to talk to you.
Thank you. Could you tell me when you first heard of LDN?
The first knowledge I had of LDN was from the internet. I picked it up from the original Good Shape website, where it was Fritz Bell, the originator, the genuine name of the chap that was going under the name of Good Shape. He was treating his wife for MS using LDN and histamine therapy.
So when did you decide to take it yourself?
I spent a year investigating and checking out this treatment. I simply could not believe that such an apparently simple method could effectively treat something as devastating as MS. And so I spent a year checking out various LDN websites, MS websites and web forums, seeking out comments about the treatment. And basically, when I found that there were no comments against it, everything seemed very positive. I simply acknowledged the possibility of a method that was effective and started using or testing at least various formulations of LDN therapy, LDN treatment, from information I obtained direct from DuPont. They sent me a list of research articles which demonstrated various formulations of LDN treatment that could be used, and I used this to evaluate and to test its effectiveness against myself. And one, I found there were no significant side effects, and two, I found it did appear to be effective in benefiting my MS.
And when did you first start prescribing it for other people?
The first occasion, I wrote an article about LDN that was presented in the October edition, year 2000, the October edition of New Pathways, the magazine of the MS Resource Centre. And following that, I'd already obtained 5,000 4.5 milligram capsules. And following that, I started prescribing it to others, obviously, and it just snowballed. It just went on and on. Within 3 or 4 weeks, I was already running out of capsules, so it's necessary to order more. And from then, it's just snowballed. It's just gone on, and other doctors and lots more patients have become involved, and the whole thing has just gathered pace since then.
And what conditions are you prescribing LDN for?
Still predominantly MS, but also other autoimmune disease like colitis or Crohn's disease, rheumatoid arthritis, ankylosing spondylitis, Sjogren's syndrome, psoriasis, conditions of that kind. It's a wide range of conditions. But recently, since last year, when we discussed the further possibility of using it more in cancer, we've had a number of cancer cases that have presented themselves, and most of these seem to be doing quite well.
You're prescribing it for many different conditions. What would you say the results have been so far?
Well, obviously very positive, but I'm just totally dismayed and disappointed that the medical profession has not locked onto this treatment and realized that this is a viable and effective treatment method. And I'm disappointed that the medical profession has not seized onto this simple remedy and started using it itself.
And have any of your patients informed you of any side effects they've had?
The side effects I've found have mostly been introductory effects, where the LDN effectively acts as a threat in treating MS, and it's a response that creates the benefit, not the LDN itself. So initially, particularly with regard to autoimmune disease, the symptoms do initially appear to get worse slightly before they get better. And if these should be considered side effects, then that may well be so. But it's a transitory period of response that creates the benefits that will be prolonged and ongoing.
And from your experience, talking to your patients, how long would you say LDN normally takes to work?
How long it takes normally to work? This varies enormously. Most people respond within a matter of 1 or 2 weeks. There can be some positive results being shown within a matter of days, but 1, 2, 3 weeks, let's say within a month. Strangely, young men seem to have the most problems because of the adverse effect of the male hormone testosterone. Young men often take a long time to adapt and respond to LDN, compared with women where estrogen provides a positive benefit. Young men seem to have a lot more trouble in stabilizing and adapting to the LDN method.
So if one of your patients said that they thought LDN wasn't working for them, how long would you tell them to try it for? It's not just a matter of determining a time schedule. It's a matter of determining why they should not be responding. In most cases, either it's because they are not following the MS diet, the approved necessary diet, or not following the appropriate level of nutrient therapy, or doing other things that may be causing them problems. There may be stress in association with the onset and continuation of the disease. So we must first aim to avoid stress, either emotional or physical or infective stress that would make the MS worse, and to ensure that the diet and nutrient therapy were suitable and adequate. I mean, there are some people that are saying they're doing everything correctly and the LDN still isn't working. Now, we had some people from that first survey that we did, for some reason or other, it would seem as like rule of thumb, by 4 months people have noticed something. But there were, I think, 5% of people that found LDN wasn't doing anything for them until 15 to 18 months.
Yeah, well, in my case, in fact, if we consider the initial time of response, in my case it took me about a year to fully stabilize on LDN. Mm-hmm. Now, this is far more than the average woman would take to stabilize, and so it may be a gender factor. It may also be related to the length of time that the person has had the autoimmune disease, MS or whatever. It may also be related to subtle forms of stress and difficulties in maintaining the regularity of the treatment. Once again, it may also be related to simply due to time. You know, some people take much longer to respond than others. And it was Dr. Gironi in her trial in Milan which demonstrated that quite often the endorphin response only builds up very, very slowly. And so in some people, the endorphin response may be so slow that they don't get a positive response for some time.
Not a good idea to give up quickly, is it?
There may also be a question about dosage, because some people don't respond to one dose or they might respond to another. And so it's important to assess and to test various doses in order to gain the best possible response.
What dose do you start your patients on?
All UK patients start on liquid LDN, which is started at 1 ml a day, and then 2 ml a day, then 3, and slowly increasing the dose in accordance with the response until we get an overall positive response at a significant dose.
And do you find there is any difference in the efficacy between the liquid and the capsules?
Not really, no. Once we establish what dose is found to be ideal, whether it be 3 milligrams or 3.7 or 4.5, once we establish the ideal dose, we simply continue that in capsule form. And
when people say if they wanted to stop taking LDN, can they just stop, or do they have to taper it off?
No, there seems to be no difference in, because it's the LDN that provides a threat. And potentially, there is no advantage in tapering it off. It's not as if the drug itself was providing the benefit. So there is no difference in tapering it off or simply stopping it dead. See, once the LDN is stopped, then you lose any advantage that was previously gained, even if that advantage was very subtle and almost invariably within a matter of weeks or months. people will begin to deteriorate once again as the disease becomes re-established.
Have you had many of your patients stop taking LDN?
Surprisingly, quite a few, but most of them will simply come back again. They will stop for various reasons, maybe economic, maybe uncertainty regarding the response, but almost invariably they will come back within a matter of months or a few weeks or a few months. They will come back and restart the LDN once they find that their MS is deteriorating once again.
How many patients do you think you've treated in the UK so far?
Overall, when I consider the number of patients that have gone on to obtain their LDN on the NHS, there are so many doctors who, once they realize that LDN is working, they will begin to accept the validity and effectiveness of LDN as valid, and they will provide it on the NHS. So considering the number of patients that have been transferred onto NHS prescriptions, probably in the region of 2,000.
So before we go, Bob, is there anything else that you think you could say that would be of benefit to other people?
The only single advice I would give with regard to LDN is that, accept the validity of the method, the knowledge and information about LDN that's already been accumulated, and simply continue it until you obtain a positive response. It's a matter of continuing the treatment until it becomes effective.
Well, I'd like to personally thank you very much, Bob, for all your help and support that you've given me personally and to the charity over the years, and to all the help to all the other patients that you've provided LDN to.
If it serves the purpose in establishing LDN as a regular treatment, not only privately but within the NHS, then I'm certainly pleased to do so.
Thank you.